Welcome back to Reclaim Your Stride. I'm Dr. Michael Wynn. I'm glad you're joining us today to talk about a topic that has become very popular in the last 5 to 10 years, which is having total joint replacement, hip and knee replacement surgery on an outpatient basis. So traditionally, patients stayed in the hospital for 3, 4, or more days after hip or knee replacement. Patients were in bed for prolonged periods of time with limited physical therapy and usually didn't start on formal physical therapy until 10 to 14 days after surgery. In the last 5 to 10 years, a lot of this has changed and patients are now having surgery on an outpatient basis, which means coming in, usually to an ambulatory surgery center, having surgery, beginning physical therapy within an hour or two after surgery, and going home later that day. So how do we get here? How do we get from several days in the hospital to being home within a couple hours after surgery? And there's multiple parts to that explanation. The first part is surgeon technique. At this point, we have more and more surgeons that are specializing only in joint replacement. And surgeons such as myself doing nearly 1,000 joint replacements a year, the repetitive practice of doing that surgery makes us better at doing it. So we're better able to handle soft tissues, better able to reduce patient pain, and get people up and moving more quickly. Another aspect is minimally invasive surgery, doing surgery through muscle-sparing techniques such as anterior total hip replacement or subvastus knee replacement that allow for exposure of the joint without cutting any muscles, and quicker recovery also contributes to the ability of patients to get up and going that day and get home within a couple of hours. Our anesthesia techniques have also improved significantly over the last 10 years. When patients come into our surgery center here, they're met and greeted by our anesthesiologist, who will then perform a preoperative nerve block before they ever reach the operating room. This block helps with postoperative pain control and helps them to mobilize quickly with physical therapy after surgery. And the final part is rehabilitation techniques. Our physical therapists we have working here in the surgery center and across surgery centers in the United States are trained specifically on postoperative joint replacement patients and knowing the rehab activities and expectations to get them up and moving quickly after surgery. So let's talk a little bit about how it works. And for that part, we'll take a walk around the surgery center. I'll put on my hat. We're gonna come over here to our pre-op area. So patients will come in the day of surgery, be placed in one of these preoperative bays. They'll be greeted by our nursing and anesthesia staff. Our anesthesiologist will then assess the patient. I'll typically come and see the patient. We'll agree on everything we're doing. And then the anesthesiologist will do a preoperative block for our hip and knee patients. And what that block is an ultrasound-guided local anesthetic around all the important nerves of either the hip or knee to help with postoperative pain control. And that's all done right here before the patient ever gets to the surgery area. So from here, we'll head back into the surgery suite. So patients will be brought back into our operating rooms for the surgery. So we'll take a look in here. Patients will come into one of our state-of-the-art facilities, have the hip or knee replacement performed, and then will be brought directly back out to head to our recovery area. After surgery, patients will leave the operating room and come to our recovery area. Patients will enter one of our recovery bays and be assessed by one of our highly trained post-anesthesia recovery nurses. And usually we'll stay in here for 30 minutes to an hour, waking up. Once the patient is awake, we'll start our physical therapy process. Our therapist will see the patients here, work on range of motion in bed, get patients up, walking through the hallways with a walker, and then come around to our staircase here. They'll train the patient on stairs, coming up and down the stairs. They will take the patient and work with the patient on getting in and out of the restroom and make sure the patient is comfortable doing all the things they need to do to get in and out of their house and to function at home. From there, once the patient's pain is controlled, once the patient has passed physical therapy, and once the patient and the family have received all of their postoperative education, the patient's then discharged home, which usually occurs a couple hours after surgery. So a couple things to consider about outpatient hip and knee replacement. First of all, not everyone is a great candidate for this procedure. Patients with significant cardiopulmonary disease, patients with cardiac pacemakers, patients with significant obesity, all of these patients may be better served in a hospital setting in order to reduce surgical risk. Some of the advantages I see for patients considering outpatient hip or knee surgery include rapid recovery after surgery. It stands to reason that the quicker we can get people up and moving, the quicker they're going to return to the activities that they love. And I've seen that in my practice. Our outpatient joint replacement patients tend to be ahead of the curve as far as their recovery. Another thing that I believe that outpatient surgery offers is reduced surgical risk in certain ways. One of the highest risk factors for developing blood clots after surgery is immobility or laying in bed. And our patients are getting up and moving within an hour or two of surgery, which I believe significantly reduces that risk. And the final thing for patients is it's significantly more convenient. Most patients would rather recover in the comfort of their own home than in a hospital setting. It's less disruptive to their family life, it's less disruptive to all aspects of their life to get home after surgery rather than spending days in the hospital. So my personal experience, I'm one of the highest volume outpatient joint replacement surgeons in Virginia. I perform approximately 1,000 joint replacements every year, and 500 to 600 of those are outpatient where patients are going home that day. And what I've seen in my practice is better patient experience, better patient outcomes, and overall higher patient satisfaction with having outpatient joint replacements. People are coming in asking for this, and we try to take everyone who's a candidate and give them this opportunity. So I hope that answers some questions about outpatient joint replacement, and you can speak with your surgeon about whether this would be a good option for you or not.